The next question, the member for Don Valley West.
Thank you, Mr. Speaker. A month ago, I visited Holland Bloorview Children's Rehab Hospital in my riding of Don Valley West. This world-class organization develops treatments, supports, and provides specialized care for children with disabilities due to illness or trauma. I asked what they needed from the Ontario government. They said they have a surgical backlog and that they need more support to clear it. Now, with children's hospitals overflowing across the province, surgeries being cancelled, bigger backlogs are building. The economic outlook says the government is holding on to contingency funds in case of unforeseen risks. While this risk of increased hospitalizations was indeed foreseen and called out by many outside this government, will the Minister of Finance acknowledge that they did not foresee this risk and that now is indeed the time to allocate funds from the contingency to help get sick kids the procedures that they need?
Minister of Health.
Thank you, Speaker. As I've mentioned in my previous answers, we were preparing for this fall respiratory challenge in the upcoming previous budget that we passed in August. We prepared by anticipating that surge in pediatrics and making sure that hospitals, both serving pediatric patients and adults, were able to build their capacity. We've done that work. I have to give a shout out to the clinicians and the hospital leadership who've worked together to make sure that when they experience a surge in their individual hospital, they work with their neighbouring community hospitals to ensure that patients who can be transferred back to their home community are able to do so. We're doing that work. We're making those investments. We've invested in additional surgery backlogs to ensure that people don't have to wait an exorbitantly long time for their surgeries. There are going to be challenges as we deal with the surge in flu or in some cases RSV, but we're working with our hospital leadership to make sure that we give them the support they need.
Thank you. The supplementary question.
Thank you, Mr. Speaker. We here in this House and the people of Ontario have heard this song before from this government, but it's now an old song, and Ontarians deserve to get the care they need, not excuses. In the economic and fiscal outlook, the minister states that his government, and I quote, has always been open and transparent. I just came from the Standing Committee on Finance and Economic Affairs, which it appears will now not be reviewing the estimates of the ministry. When presented with an opportunity to reschedule, his colleagues refused to find the time to ensure that the residents of Ontario and even their own constituents would get answers about government expenditures. Does the Minister of Finance agree with his colleague's decision to block the review of his ministry's estimates? And if not, when would he be willing to meet with the Standing Committee of Finance and Economic Affairs to be open and transparent with members of provincial parliament? Thank you.
Minister of Finance.
Oh, Mr. Speaker, I don't know where to begin on this question. You know, I'm hearing from the member opposite whose party there, you know, when faced with the Auditor General looking at the books, didn't get a clean audit. You know, Mr. Speaker, the Auditor General of Ontario had a qualified opinion for their books, Mr. Speaker. Not our government. 5 years of clean opinion from the Auditor General, Mr. Speaker. And, Mr. Speaker, let's look at the election, the pre-election budget review. The interim leader knows this full well. The auditor looked at the books and says, these numbers, they add up, they're reasonable. Mr. Speaker, when they went to the electorate in 2018, she found that they were not reasonable. They didn't paint a fair picture. Mr. Government, Mr. Speaker, our government did. And finally, I'm out every 90 days, and the minister, he knows that. He knows that. Every 90 days. His government didn't go out every 90 days.